Hello, my name is Holly Walton and today I'm going to be talking to you about our project, which was titled Defining and Identifying Components of Coordinated Care for Chronic Conditions, and this was a scoping review. If you would like to ask any questions throughout the presentation, please comment below the video and I will respond as soon as possible. Also, I would just like to thank my co-authors for their help throughout this study. Also, just to highlight that this study is part of the larger project CONCORD, which stands for Coordinated Care of Rare Diseases. So why is this research needed? So accessing treatment for chronic or rare diseases can be particularly difficult. And this is due to requirements to attend multiple health appointments with different specialists on different days and in different locations. This can be burdensome for everybody involved, especially for patients and carers. In order to ease burden, we need to coordinate care more efficiently. However, if we're to improve coordination, we first need to understand what coordinated care actually means. So we need a clear definition of coordinated care. And linked to this, we need to know exactly what coordinated care consists of. So what are the components? So what did we want to find out? So for this study we had three main aims. The first was to develop an updated definition of coordination for chronic conditions. This included both common chronic conditions and also rare conditions. We also wanted to identify components of coordinated care. Finally, we wanted to understand whether findings were relevant for rare diseases. Now, the reason that we focused on chronic conditions more generally is that there is little research which focuses on rare conditions. So how did we do the research? So we used a scoping review methodology, which means that we searched for and screened relevant review papers. So for the scoping review, we followed the 6 recommended steps proposed by Arksey and O'Malley. The first was that we defined the research question. Secondly, we identified relevant studies. Thirdly, we selected reviews. Fourth, we charted the data. Fifth, we collated, summarised and reported the results. And finally, we consulted with stakeholders. So reviews needed to have met a range of criteria, including focusing on coordinated care and focusing on chronic or long-term or rare conditions. For this review, we used findings from 154 reviews. 139 of these focused on common chronic conditions, 3 focused on rare conditions, and 12 focused on both common and rare chronic conditions. In addition to the scoping review, we also conducted 3 focus groups. 2 of these were conducted with patients and carers with experience of living with rare, ultra-rare, or undiagnosed conditions. 1 focus group was conducted with healthcare professionals who had experience of working with people with rare, ultra-rare or undiagnosed conditions. So we used thematic analysis in order to analyse the data from the review papers and develop a definition and identify components. We identified components and categorised them into 4 groups. The first was components that may need to be coordinated. These are our what components. These components may or may not be coordinated in practice. For example, patients and families could receive support, but this support may be uncoordinated. The second is components that tell us how to coordinate care. These components provide ways in which care can be coordinated, for example, having a care coordinator. The third group of components are those that have multiple roles, and these are components that outline how care could be coordinated, as well as what components could be coordinated in a care pathway. For example, care planning. Now these components are almost a combination of the blue and the pink, but these components have both of those roles. The fourth grouping is components that contextualise care delivery and coordination. And these components do not necessarily provide clear methods for care coordination, but actually these ones may influence coordination. For example, a person's access to treatment. We also use thematic analysis to analyse the focus group findings. So our first aim was to define coordination. We have updated a definition of coordination for chronic conditions, including common and rare conditions, and the highlights of our definition include working together across multiple components and processes of care, enabling everyone involved to avoid duplication and achieve shared outcomes. Coordination must be throughout a person's whole life. It must take place across all parts of the healthcare system. It must be family-centred, holistic, evidence-based, and provide equal access, irrespective of diagnosis, patient circumstances, and geographical location. The second aim of our review was to identify components of care coordination for rare conditions and chronic conditions. So we had a range of findings, as you can imagine, from the scoping review and the focus group consultations. And in order to summarise and present these findings concisely, we have developed this diagram. And I'm going to briefly talk through this diagram and summarise each aspect of care coordination outlined in the diagram and give one example for each of these. So the first one I'm going to focus on are the what care pathway components need to be coordinated, and these are the ones in the bottom of your screen here. So the components that may need to be coordinated are related to administration, assessment and diagnosis, planning, review and evaluation, feedback, follow-up care, technology and support. The scoping review found that components relating to these aspects of care were frequently reported. Focus group findings also highlighted the importance of these components in the context of rare conditions. For example, assessment and diagnosis were identified as key elements for providing access to necessary care. However, despite these components identified as important, participants reported that not all of them were delivered in practice. So participants reported not having care plans or regular reviews despite their potential to prevent crises and ensure ongoing provision of appropriate care. The second components that I'm going to focus on are the which components tell us how to coordinate care, which are these ones here in the pink. So components outlining how care can be coordinated included someone taking responsibility, communication, specialist centres and joined up clinics, support and other methods. The one that I'm going to give examples for today is taking responsibility. Scoping review findings highlighted many components relating to responsibility. One of these was responsibility for coordination by one healthcare provider. Focus group findings also provide support for and extend review findings by suggesting that for rare conditions, having someone to take responsibility for coordinating care is key. However, as with scoping review findings, who should take responsibility was more contested, and findings indicated that this could range from healthcare professionals to patients or carers, administrative staff or GPs. Finally, I'm going to give a quick summary of the components that contextualise coordination, and these are the ones in the top in yellow. So scoping review findings demonstrated that evidence-based practice, individual differences, the wider healthcare environment and access to treatment contextualise coordination. Scoping review findings identified many components relating to these factors. I'm going to give examples just now for evidence-based practice. For evidence-based practice, scoping review findings identified guideline-based treatments and evidence-based treatment protocols as examples of components. Stakeholder consultation, so the focus group findings, also indicated that centralised and shared care pathways are needed, but that there is a lack of care pathways or defined standards for rare conditions. Additionally, where guidelines or care pathways do exist, treatments are not delivered consistently to these standards. So I've given you a flavour of the findings today, but if you are interested, this paper will hopefully shortly be published in the International Journal of Integrated Care, so you'll hopefully be able to read more about it if you're interested then. Finally, we aim to apply findings from chronic conditions to rare conditions. To do this, we discussed the findings of the scoping review in the focus group consultations in order to understand whether the findings were relevant to rare conditions. We found that findings are generally relevant for people with rare conditions. However, findings indicate that care is not coordinated for people with rare conditions. We also identified that there are some further complexities that limit care coordination for rare or undiagnosed conditions. Some components were also felt to be missing or needing to be emphasised for rare conditions, including genetic screening. So our key take-home messages are that coordinated care is multifaceted and that it has generic and context-specific components. There are many ways in which care can be coordinated for people living with rare and common chronic conditions. These findings have many implications. The first is that findings can help to develop and eventually test different ways of coordinating care for people with rare or common chronic conditions. The second is that contextual factors can be considered when developing models of care coordination for different groups. Thank you so much for listening to my presentation. We would love to hear your questions and comments. To send these, please comment below the video and I will respond as soon as possible. If you would like to find out more about the Concord study, please click on the hyperlink on the slide. This will take you to our Concord webpage. I would also like to quickly acknowledge the funding that we received for this study. So our study is funded by the NIHR Health Services and Delivery Research Programme. I'd also like to thank the wider Concord team and all of the participants who took part in this study. Thank you, and thank you all for listening.